Okay. Or it's recording. So hello everyone. After a long time, we are back in Prabhucast, and this time we have with us Dr. Don Kuruvilla, if I pronounced it correctly. So very graciously, he accepted our invitation for this interview. And thank you, doctor, first of all. And just to give you a very quick introduction, he's a doctor. I think you're passed out from CMC, right? CMC Weldor. And he is married to Dr. Daisy, got two kids, Ashray and Ashita, right?
Yes.
And currently he's working in one of the mission hospital in UP. So thank you so much, doctor, for saying yes to this interview. It's a privilege for me to interview you on this very important topic. So this was a very short introduction from my side. I would love if you can introduce yourself too.
Hi, thanks Desmond for this opportunity. It's always good to uh, talk about things which I'm passionate about. And uh, I am a medicine consultant. I work in a secondary hospital, which is a Christian Mission Hospital, located in southeastern part of Uttar Pradesh in a district called Sonbhadra. So this is at the end of UP, and we are around 2.5 hours away from Varanasi, which all of you know is a very. It's also called Banaras or Kashi. So we are very close to there, and Mahakumbh Mela happened in Prayagraj, which is also the adjacent district. So I'm located somewhere there in UP. I am originally from Kerala. Uh, was born and did my UKG and LKG in Ranchi. So I'm partly in a North Indian and mother tongue is Malayalam. But then I did my studies both MBBS and MD General Medicine in CMC Vellore, which is in Tamil Nadu. Yeah, so I'm happily married to Daisy. We have two wonderful children. Asha is 6 and Ashita is 1.5. So Daisy and I met in Chinchpada Christian Hospital in Maharashtra, which is also a Christian mission hospital near Gujarat, in the on top of Maharashtra, near Surat. We worked there for a year. Daisy was already there for a year before I went and worked with her there. And I have also worked in Orissa, in a place called Khariyar in southern Odisha, I should say now. So I have worked
Yeah.
there. I've been here in UP for the past 2.5 years. So yeah,
2.5 years.
yeah.
That's good. That's good. Okay. So great journey. So yeah, thank you for sharing your journey with us. That was a good overview. But we would also like to know a little bit in depth your personal experience within this medical industry. What all did you learn? Your experiences, anything that you would love to share, especially with students who are getting into this medical industry right now. I have lots of young people who are getting into medicine, and of course, what made you say yes for this interview?
So maybe I should start why I wanted to become a doctor and the role, various factors like personal beliefs, the values I
Of
grew up
course.
with, my family background, the ethos of the college where I studied, and how
Mm-hmm.
it influences my thinking and practice and behavior as a doctor. Because I believe no physician in this healthcare profession works with an head only with medical facts. No doctor truly works with a neutral, unbiased worldview system. Always, whether he is aware or
Mm-hmm.
not, always doctors and healthcare professionals apply their view of the world with a deep sense of values, morals, ethics to their work and daily life,
Mm-hmm.
with their patients and with the people whom they are supposed to manage and take care of. So it was my
Mm-hmm.
mother, a sincere Christian lady from a very conservative um, Malayali background, Christian background, who had learned to live and die by the truths of the scripture, and who had learned to depend on Jesus for her very when life and existence, because she had a difficult childhood, and she was the one who was instrumental in kind of leading me towards taking and choosing medicine. She used to read to me stories of missionary doctors like David Livingstone, and used to tell me the stories about missionaries like Ida Skada, William Carey, who came to India and to Africa and to very difficult places and served people and spent life helping others. And she taught me that this is one profession where you can give a lot of hope and light to people in their time of urgent and very distressing need. So um,
Mhm.
she did not protect me from the suffering and the problems of the world. I mean, in fact, no parent can do that. But when that happens, we don't have to lose hope. We can rely on the wisdom God has given us, the science which we have in our disposal for solving the problems, and
Mhm.
so she was the one who helped me think that medicine can be a good option to help people, to serve others, to give hope to people, etc. So um, uh, and she was the one who really encouraged me and not gave up on me when I had to try a couple of times to get into a medical college. And finally, when I got in 2009, I mean,
Mhm.
I didn't mention my dad. I mean, both of them were very instrumental, but it was mom who really guided me. Though
Mhm.
I was fairly good in my studies and worked hard for my exams and got a good rank, I had to learn a lot of humility and patience, because the getting into a medical college process can be very long drawn and can be very
Mhm.
difficult. So I had to write a lot of exams at that time. Now we have a single exam for getting into all the medical colleges. And I remember in 2008 when I had to prepare, and I dropped a year to prepare for my entrance exam for getting into a medical college. I had to write 8 exams, and I remember daddy and me going from one state to another state, one city to another city. So it was my parents' perseverance and obviously God's grace in helping me as a young person to go through that difficult season. And finally, in 2009 is when I joined CMC for my undergraduation. And I think after being born in a home where Christian truths were impressed on me from a very early age, studying in
Mhm.
CMC Vellore has been one of the greatest blessings in my life. So I say it not just because CMC is a premium academic institution of academic excellence, but CMC has flourished in the soil of strongly Christian value-based system of education, and uh, CMC gave me a patient-centric teaching of clinical medicine. I had wonderful teachers who modeled for me rigorously
Mhm.
rational and humanely compassionate uh, medicine, which is evidence based. You don't have to leave the rigorous science while you are focusing on compassionate care. Both goes hand in
Mhm.
hand.
And-
So my alma mater has really shaped me in that way to be excellent at work, applying the science of medicine without forgetting the sensitive human touch required in dealing with real patients with real problems. So
Mhm.
William Osler, who is the father of medicine, has said that a good doctor, a good physician treats the disease, but a great doctor treats the patient who has the disease. तो अच्छा डॉक्टर मरीज का इलाज करता है, और जो डॉक्टर सिर्फ बीमारियों के बारे में सीखा है, बीमारियों का इलाज करते हैं. तो so we are learned to treat the person with the disease. So
Right.
and I
I'm
think
sure he was Christian.
I've not read his autobiography. It's in my bucket list to read. Lekin the Western civilization we know has grown up with a very deeply Christian
Mhm.
understanding of reality. So I'm sure people worked with such an assumption. So human beings are not just blocks of scientific experiments to do. So yeah. So I've learned to address the patient first, thanks to my teachers in Vellore and the influences I've had in mission hospitals, where many of the people I've worked with taught me that the compassionate care is the foundation of giving competent, good medicine, which has to be contextualized to the patient situation. तो सब मरीजों को एक ही इलाज नहीं है, कोई भी गाइडलाइन में कुछ लिखा है या कुछ टेक्स्ट बुक में कुछ भी बीमारी के इलाज के बारे में लिखा है, उसका अर्थ ये नहीं है कि हम वही सब मरीजों के लिए करें. तो किस मरीज का इलाज कर रहे हैं, फर्स्ट होना जरूरत है. एंड किसके तरफ हम हमारे प्लान बना रहे हैं या किसका ऑपरेशन करने जा रहे हैं. So that is so important as much as the technology you have and the test you are going to do and the treatment you're going to inject. So one thing I also learned, thanks to my good mentors and teachers, is that see, disease diagnosis and treatment are a very complicated process, and our science which we have, the medicine we have, is a imperfect science actually. And the art of practice of medicine has its own limitations. But when you keep the individual at the center, the person you are treating at the center, and bring the person along with you as you go through this process of diagnosis and treatment and all of that, you much good can be done. तो तो जिस व्यक्ति के लिए हम इलाज कर रहे हैं, जिस मरीज का हम बीमारी पकड़ने के लिए, जांच करने के लिए, इलाज करने के लिए हम कोशिश कर रहे हैं, उनको भी हमारे साथ लाना है. And he has to understand and he has to be part of the decision making team. और ये ऐसे नहीं कि मरीज कुछ तकलीफ के साथ आया, तुरंत हम बीमारी पकड़ ली और इलाज कर लिया, कहानी खत्म. So people think that medicine and diseases are very simple, and treatment is like 1 + 1 is equal to 2. लेकिन वो नहीं है सच्चाई. And so my professor, Dr. Samuel Hanstack, used to say that the goal of treatment is not to diagnose more diseases, but to reduce morbidity and mortality. मतलब हमारा इलाज करने का, पेशेंट के साथ बात करने का, पेशेंट को भर्ती करके उनका जांच करने का इरादा ये नहीं है कि हम ज़्यादा बीमारी पकड़े. हमारा मकसद ये है कि उनको ठीक करके उनको नॉर्मल बनाए. So the focus is not on the disease as much as how we can get the person back to becoming normal, back to the well-being state he or she was in. I hope you're able to follow what I'm trying to say.
Of course, of course. In fact, as you were talking, should I go with Hindi?
Yeah. बोलिए, हिंदी बोलिए.
हाँ, मैं यही सोच रहा था कि I've heard this somewhere कि theology is the mother of all science, right?
Yeah.
Right. And today exactly इसका opposite हो रहा है, right? People are divorcing morals with all the fields of science, not just medicine, but all the fields of science. और तभी we are seeing so much chaos in this technological development, right? So yeah, even when you were
Focus has
talking,
gone from health to diagnosing more diseases. The focus has
hmm,
gone away from how to restore health, but to how to diagnose more diseases.
right, right.
Yeah.
So
So
wait, it has separated, right? Morals and you just calm it. Everything is just
yeah.
blocks of things like you need to do this. But humans are more complicated than that, right?
But that being said, we as
Mm.
doctors actually are not trained to really promote healthy living as much as to reduce the problems which hamper health. You understand, no? Our training is not to promote health, I mean, or to find what is the best way people should be healthy, but to treat diseases and illnesses which cause problems to health. So we are trained and taught to diagnose and treat diseases, and to
Mhm.
mitigate illnesses which disturb your well-being
Mhm.
and make you unhealthy.
Mhm.
But what really constitutes being healthy is a really interesting concept, isn't it? For example, uh, if a if there is a married couple, and they are coming to me saying that they are pregnant, or the lady is pregnant. uh, is there something to be treated? Isn't it something very normal?
Yeah.
शादी किए हुए लोग प्रेग्नेंट होते हैं. That's not doctor to treat or mitigate, isn't it? Pregnancy is
Right.
a normal thing when people get married and stay together and all of that. So, how about having a bad headache at the end of a stressful day at work? Is there something to be treated for, or we should just take rest and have a cup of good coffee, or and just listen to some good music, or somebody gives you a head massage or something like that?
Yeah.
How about knee pain in a 70-year-old dadi who has been squatting her entire life for work and washing clothes and washing burtan and uses an Indian toilet and all that? Is it a disease which a doctor has to sort out and mitigate? Other example is just now, one of the nurses who worked in a hospital just called me. She is went for a further study. She called me and said, "Sir, एक रिश्तेदार कल आएंगे आपको मिलने के लिए. उनका थोड़ा जांच में भेज रहा हूँ आपको." तो मैंने पूछा तकलीफ क्या है? जांच भेजना तो हम जांच हम देख लेंगे, वो तो नंबर्स है. परेशानी क्या है जिसके लिए मैं आप उनको कल देखूं? सर, उनका यूरिक एसिड बढ़ा है. तो मैं पूछा तकलीफ क्या है? यूरिक एसिड बढ़ना तो वो एक एक जांच है. तो तकलीफ सर शरीर में दर्द है, हाथ पैर में दर्द है, एड़ियों में दर्द है. सो what is this we are dealing with? I mean, are we gonna treat the lab report and the things which appear like diseases, or are we gonna talk to the person with the problem and see how we can restore them to health? Um, um, what I'm getting it is that we have a problem with understanding what really is health and what really is normalcy. WHO
Mhm.
definition of health, all of us have heard of. Health is a state of complete physical, mental, social well-being, and not merely the absence of a disease or an infirmity. सुना होगा आप लोगों ने कि सेहत यही नहीं है कि बीमारी नहीं है या तकलीफें नहीं है, लेकिन वो पूरा मन का, तन का, और हमारे इमोशनल एंड some people even had spiritual well-being. So for
Mhm.
example, you may be having a major problem going on in one side of your life, but may appear very healthy and happy generally, isn't it? And you will be getting on with life as usual, with many health problems being treated. And when somebody meets you on the road or in a bus or something and just talks to you, you may not appear unhealthy at all. You may be very happy and content, and then you might be taking many medicines, and you might be having a diagnosis which requires lifelong treatment and all of that. That is one situation
Mhm.
to help you understand that health is not just something related to body. ऐसे भी सिचुएशन है
Mhm.
जहां हम मन में बहुत परेशान है, बहुत स्ट्रेस्ड है, डिप्रेस्ड है, अनएबल टू कोप विद जिंदगी के सिचुएशंस के साथ, and we may not be having any interest in any good things, like having friends or going out and enjoying and things like that. And but शरीर में पूरा तंदुरुस्त रहेंगे. All the blood test will be all right. If you go to a doctor and tell that I'm not well, he may do a full examination of your body and say that you're healthy. So I may be having a lot of health issues I'm troubled by, and going to a doctor with lot of complaints like indigestion or headache or body pains and whatnot, and the doctor might examine me a lot, do a lot of tests, and say that you are completely fine. So, what
Mhm.
really is being healthy, being all right for a person might be very different from person to person and depends on many other things than just शरीर का तकलीफ. So some people say कि आप बहुत complicate कर रहे हैं ये सब चीजें, and doctors should just occupy themselves with treating real, treatable, organic body diseases, and get out of this moralizing of health issues and people's problems, which I believe has strong implications for their health. Like, for example,
Mhm.
can I really tell my patients to take treatment? जैसे सोचिए कोई मरीज आ रहा है, एक्चुअली आए
Mhm.
एक और कोई दिक्कत के लिए. जैसे हमारे हॉस्पिटल में आई डिपार्टमेंट है, जहाँ बहुत सारे लोग आंख के दिक्कत के लिए आते हैं. वहाँ आंख के डॉक्टर देखते हैं आंख के परेशानी के लिए. लेकिन उनको लगता है कि शायद आंख में ही दिक्कत नहीं, बल्कि कुछ कुछ टेस्ट करते हैं और आता मिलता है शुगर बीमारी या बीपी बीमारी।
हम्म,
आए हैं और कोई दिक्कत के लिए, लेकिन मिला है और कोई वजह जिसके लिए
हम्म,
उनको मरीज को लगता होगा कि इसके लिए तो मुझे कोई दिक्कत ही नहीं है, आप क्यों मुझे नए बीमारी पकड़ के मुझे मरीज बना रहे हैं।
हम्म,
So then, how do you tell them to take medicines for diabetes, which might be a silent disease for now, लेकिन आगे बढ़ के दिक्कत करेगा। जैसे शुगर
हम्म,
और बीपी बीमारियां ऐसे ही कि तुरंत कोई तकलीफें नहीं दिखाता है शरीर में, लेकिन धीरे धीरे धीरे
हम्म,
एक एक शरीर के एक एक भागों को नुकसान करता है। जैसे किडनी बीमारी बनाता है, एक दिन तुरंत हार्ट
right,
अटैक
right,
होता है
right.
और तभी मालूम पड़ता है कि शुगर 400 500 में था और बीपी 200 के ऊपर था। सो
हम्म,
so then, how can I really be telling my patients to take treatment even when they don't like it, or they don't want to take treatment, or tell them to stop smoking, not to indulge in risky, dangerous behavior for the sake of their health? And that's what I'm saying. So healthy living and disease
हम्म,
treatment can't be really separated, isn't it? They
हम्म,
both are not really different, two different things. सो
हम्म,
डॉक्टर बन के हमारा काम यही नहीं है कि जो सोच लीजिए एक रूम पे बहुत पानी भरा है, पूरे फ्लोर में पानी है, हम और हम क्या कर रहे हैं कि डॉक्टर लोगों का काम, कुछ लोग समझते हैं कि ऐसे है कि आप पानी एक तरह से मॉप करते रहिए, लेकिन आप या
हम्म,
टैप बंद करने का या जहाँ से
right,
पानी लीक हो रहा है उसका उसके बारे में
हम्म,
बहुत टेंशन नहीं करिए। जहाँ आपको
हम्म,
पानी दिख रहा है वहां पहुंचते रहिए। सो सो देन यू अंडरस्टैंड नो, सो वी
right, 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 right.
dealing with real human beings whose diseases and illnesses and symptoms are involving their entire being। तो उनके जो
हम्म,
मन में चल रहा है, उनके जिंदगी में जो चल रहा है, परिवार में जो चल रहा है, वो सब का implications हेल्थ में है। So all
हम्म,
advice we doctors give to patients involves bringing our values and foundational beliefs about
हम्म,
what we believe is to be normal and what we believe is real health।
हम्म,
So
हम्म,
and we also know that disease and health issues affect all aspects of our lives।
हम्म,
And जैसे हम जो विश्वास करते हैं हमारी जिंदगी के बारे में, हम जो चीज गलत है, जो चीज सही है, जो चीज अच्छे है, जो चीज बुरे है, and our lifestyle choices are the practices we have at home about various things, वो सब
हम्म,
हमारी सेहत में उसका असर पड़ता है। सही है ना डिस्मन?
right, right.
सो
When we सोच रहा था, see, so my pastor shared this story once. There was in this building, all the people were facing this issue कि सबके दीवारों में दरारें आ रही है, and they were filling that cracks again and again and again. Then finally they called the builder, and he went straight to the basement and fixed the poles there,
या
and the cracks never came again. So hitting at the roots of the issue, that's what you're talking about, you know?
या
Looking at what is causing that overall issues, right? Because the cracks are just the symptoms.
and also, I mean, that is one, and also that diseases not just affect your body but affects your entire well-being,
Yeah.
and all the
Yes. Sure.
diseases and all the way you perceive your disease and the way you perceive the treatment has a big impact on the way you will become better or not.
Mm,
Yeah, and also
right.
your view of suffering, or
Mm-hmm.
your view of disease, your view of death, your view of recovery,
Mm-hmm.
your view of investment in your well-being, your all influence a doctor-patient relationship. So there is no neutral ground to simply interact with a patient, but always a relationship built on trust and agreed
Mm-hmm.
upon moral principles by which a doctor works with and helps a patient who has come to him.
Right.
So
Right.
I'm sorry for philosophizing my work and my profession a
Of course,
lot,
sir, of course.
but it's suffice to say that the grid or the compass or the जो चश्मे हम पहनते हैं दुनिया को देखने के लिए, जिस आईने से हम हमारी जिंदगी को, हमारे सेहत को, बीमारी के इलाज को देखते हैं, वो हमारे अम, दवाई लेने के आदत, डॉक्टर को मिलने का
Mm,
फ्रीक्वेंसी, the way we stick to the advice which the doctor gives, वो सब में उसका असर पड़ता है। सो
mm,
सो एवरी वो मरीज के लिए ही सच नहीं है, डॉक्टर के लिए भी सच है। तो
हम्म,
जो डॉक्टर आपको सलाह दे रहे हैं किस चीज के
हम्म,
बारे में, किस दवाई के बारे में, किस इलाज के
हम्म,
बारे में, उनका विश्वास, उनका
हम्म,
जिंदगी, उनका उनके मन में जो भी चल रहा है, और
उनके वर्ल्ड व्यू बेसिकली।
yeah, your worldview. So
हम्म,
the doctor's morality and foundational values undergird everything he
हम्म,
practice and do for up do for his or patients. So it
आई
does
थिंक,
also.
yeah, sorry to cut you. I think this is a good point to get to the topic. जैसा कि आपने बोला कि डॉक्टर के जो वर्ल्ड व्यू है, जो सोच है, जिस चश्मे से वो दुनिया को देखता है, that matters.
Yeah,
So as we decided, today's topic is actually abortion,
yeah,
and it's very common आज के time पे that people have a specific worldview towards this, right?
yeah,
MTP, medical termination of pregnancy, is just another procedure, right? And that's how doctors are trained, right? That's how doctors are trained. That even as we were reading this book, Abortion in India, by I think Kabra, uh,
yeah,
he says that doctors are desensitized, right? To just teach them that this is just another procedure that you're doing. Uh, yeah, if you want to comment on this, like how
so
much sense
I
does
I
that make?
come I've studied in an institution which was started by a lady called Ida Scudder. Her story is very famous. I'll just briefly say what led to the beginning of CMC Vellore. And anyone who has passed through the doors of CMC as a patient or a doctor of or any allied healthcare professional who studied there or worked there will know this. So she came home to be with her father, who was a missionary doctor in Vellore, in a part of Vellore, and they were living in a bungalow. And one night, three men at different times of the night came and knocked on her door and asked for help for the delivery of their wives who are in labor. तो जब भी तो पहले एक मुसलमान आए, फिर एक ब्राह्मण व्यक्ति आए, फिर एक अलग जाति के लोअर कास्ट के एक व्यक्ति आए और पूछे कि मैडम, मेरी वाइफ डिलीवरी में है, आप आके मदद कीजिए। ही सेड आई एम नॉट अ डॉक्टर, मैं मेरे फादर जो है डॉक्टर, वो आके मदद कर सकते हैं। लेकिन उन्होंने बोला कि नहीं, कोई कोई और आदमी आके हमारे पत्नी का मदद नहीं करना है, आप आना है तो आइए, नहीं तो छोड़िए। So then she couldn't help them, she couldn't convince them, and all three of them died the next morning. And all three of those ladies who were in labor, whom she couldn't help, she came to know that they died the next morning. And that is what inspired her to go get trained in the US and come back and set up her CMC. So this is the so I come from a institution which value the life of woman, which was instituted because a young girl's heart was moved by seeing the plight of the suffering of women in India, especially in where she saw. So, but the current, so that is one part of the moral framework which I have. I even remember that when I was posted in final year in the labor room जहाँ deliveries होता है, हम लोगों को 20 डिलीवरी को मॉनिटर करना और करना पड़ता था फाइनल ईयर की शुरुआत में. So I remember me and my good friend, who is now an orthopedician in the UK, we both were very sad seeing the Muslim women in the labor room who were delivering their fourth child or fifth child for a boy child. And we were very moved by seeing their distress and their difficulty, and the fact that they had to go through a lot of pregnancies and all of that, that we thought we should do obstetrics. We should become obstetricians and help and relieve the pain of these women and give them good antenatal care and help them in their delivery and all of that. So that is one part of my upbringing where I really care for women. My heart goes out for the distress which Indian women face. I already told you about the story of how I was shaped and guided towards medicine by my dear mother. I also told that I'm married 7 years. I'm not very old actually. I got married a bit early in my early 26. I mean, when I was 26. I prayed for a daughter when she was pregnant the first time. A, a naughty boy came out, but thankfully God heard her and gave me a daughter who is the joy of our life and
Praise God.
the rhythm of our house now, with all our tantrums and playfulness and jokes. So I and one of the greatest influences of my life and on whom I have named my daughter is Dr. Ashita, who has taught me how to be a good internal medicine person. I worked with her in a mission hospital in uh, in Maharashtra. So all of these women have really influenced and shaped me, and I'm grateful to God that um, uh, women exist and they are precious to me. That being said, the some of the gynecologists who I was talking to in preparation for this interview, all of them were telling me one same thing, one recurring theme, that they were saying that as gynecologists, as obstetrician, we are supposed to prioritize the life of the mother always and absolutely. जो भी हो, माँ का जिंदगी बचाना, माँ के लिए या जो औरत जो प्रेग्नेंट है उनके लिए सब कुछ करना और उनके सेहत के लिए उनके रक्षा के लिए करना
Mhm.
ही है सब कुछ. I think there's something weird going on here, strange going on here. We live in a very individualized
Mhm.
society. Some people call this an atomized world where selfhood is glorified. As doctors, we always treat a
Mhm.
person. I already told you, we don't just treat the body. We always treat a person. And ये जो व्यक्ति जो हम इलाज कर रहे हैं, that is not just a person as an individual, isn't it? He comes in the context of the family, the people to whom he belongs to. And when somebody says that when you treat a lady who is pregnant, we care only about the lady and the husband's interest, the family's interest, and the interest of the person inside the pregnant lady doesn't matter really as much as the well-being and the health of the mother. I think we are we are
Right.
living in a ulta world, a messed up world. And when I asked about when I ask a lady about her husband or the man who is responsible for the child and the baby inside of you, um, uh, I mean, when that person has equal rights to the baby inside of a lady, isn't it? So
Mhm.
what I'm trying to say is we should not forget that when we deal with a pregnant lady on
Mhm.
whom we have to give treatment for helping her to go through
Mhm.
the pregnancy, we are dealing
Mhm.
with at least two human beings.
Mhm.
See, I
Mhm.
can't be a doctor and call myself a doctor and act however I want. I have to
Right.
live up to the standards of my profession. A lady who
Mhm.
is pregnant with a baby cannot act however she wants. When I got graduated,
Mhm.
my principal made me say an oath saying I have to act befitting of a doctor. When a lady becomes
Mhm.
pregnant, she is pledging that, or whether she likes it or not, whether so that's what when you become an engineer or when you become an architect or when you decide to do whatever you are pledging
Mhm.
to do, or when you're joining a job, you have to act like that person, isn't it? So
Right.
the pregnant lady is pregnant with someone, and saying in absolute terms that in any situation you must save the life of the mother is a dangerously
Mhm.
simplistic approach, forgetting the baby, the real person inside.
Mhm.
एंड when we say that, जब कोई भी व्यक्ति ऐसे बोल रहा है कि माँ का ही सेहत और या माँ का ही जिंदगी सब कुछ है, तब हम क्या कर रहे हैं कि we are
Mhm.
shutting the voices of the weaker, the smaller, the voiceless baby who is automatically assumed to be
Right.
expendable for the sake of the mother. So throughout life, whenever we deal with pregnant women, we have to know that we are
Mhm.
dealing with two people here.
Two people.
I mean, I
Right.
would even say we are not dealing with two people, we are dealing with a family, a
Right.
father, a mother, a baby. And
Right.
obstetricians don't treat women, obstetricians treat mothers. Or
Mhm.
I am an internal medicine person, a physician. I treat men, women, old people, young people. But obstetricians, जो लोग
Mhm.
जो लोग प्रेग्नेंट लोगों का इलाज करते हैं, they don't treat
Mhm.
women with children, whether they are inside,
Mhm.
outside, whatever. So,
Right.
so
So, just to clarify, वो very easily जो आपने बोला अभी इसको इस तरीके से लिया जा सकता है कि the common saying is take care of mother in any case, anyway, right? Uh, but we are not saying that the baby is more valuable than the mother, right?
Yeah.
What we are saying is there are two equal human beings, equal as in equal in value, है ना, जिसको, और दो पेशेंट्स है यहाँ पे, दो इंसान है, किसी की वैल्यू दूसरे से ज्यादा नहीं है, राइट? दैट्स व्हाट वी आर ट्राइंग टू से, राइट? या just want to clarify this बहुत easily इस चीज पे.
So listen, Desmond, we had to abort the plan for meeting when meeting for this interview many times ना. हम
Right,
लोग
right,
बहुत दिन से प्लान कर रहे हैं, लेकिन बहुत बार we had to cancel the plan. We had to.
right.
So in English, when we say I had to abort the plan to go to Singapore because I didn't have money,
Mhm,
what we mean is we changed the plan, or we couldn't go ahead with the plan. So
mhm,
the medical termination of pregnancy, the law talks of pregnancy like
mhm.
medical termination of pregnancy, like it's like some project or some travel plan or some visit you were planning, and कुछ वजह से वो हम नहीं कर पाए
Cancel
because
करना.
of personal inconvenience, or we were not in a mood, or something came
Mhm,
along.
mhm,
A lady can't plan a pregnancy by herself. So the
Right.
MTP law में ऐसे है कि एक किसी औरत को अपने प्रेगनेंसी को टर्मिनेट करना है. I would even say even pregnancy terminate karna is also a euphemism of
Euphemism. Yeah.
literally saying that I killing this human being inside of me, or eliminating this baby who's giving me inconvenience.
Motherhood.
Anyway, so the law says one of the clauses of the law is that at least the change in the law in 2002 to 2022 was that a lady can't plan. I mean, lady can go ahead and terminate the pregnancy and need not get consent from the partner or the husband.
Right.
So the funny thing is the lady did not become pregnant by herself. अपने से तो pregnancy नहीं होता है,
Mhm,
but can cancel her pregnant state by self-made decisions. And the reason is
Right.
I like planning. I don't like this happening now, or the, and the law
Mhm,
says that you don't even tell the person with whom you had this pregnancy. That's crazy, isn't it?
mhm,
So the government and the law making bodies have succumbed to such weird notions of reproductive rights. जैसे जब reproduction
mhm,
की बात करते हैं, reproduction means producing somebody else. The word means
mhm,
reproducing. You're producing something.
mhm, mhm,
It's not reproducing your hair. It's not reproducing your नाखून. हाँ, नाखून कभी भी काट सकते हैं, जब चाहे काट सकते हैं, कितना लंबा चाहिए उतना रख सकते हैं. जितना लंबा बाल चाहिए उतना रखिए. जैसे you have kept a good beard, handsome looking manly beard, you can cut it when you want to. And I and but the that is your right to keep a beard. And when we talk about reproductive right, we say, so
mhm,
there are patients who come to me that Desmond, like शनिवार को ही जब मैं ओपीडी में बैठा था, कुछ लोग आए और बोले कि सर हमारे हमारे ऑपरेशन कर दीजिए, मुझे मेरे मेरे पित्त के थैली पे पत्थर है, मेरा मेरा कोलिसिस्टेक्टमी कर लीजिए. तो मैंने बोला रुकिए रुकिए भाई, क्या हो रहा है, पहले बोलिए क्या परेशानी क्या है.
mhm,
क्यों आप ऑपरेशन कराना चाहते हैं, क्या दिक्कत क्या है
mhm,
आपको जिसके लिए आप ऑपरेशन में. नहीं 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 सर, वो सब छोड़िए, आपके यहाँ ऑपरेशन होता है ना, मैंने सुना है आप ऑपरेशन का प्लान कर रही. सो देन व्हाट शुड द डॉक्टर डू? शुड टेक हिम टू द थिएटर एंड रिमूव हिज गॉल ब्लैडर? और फॉर एग्जाम्पल somebody is coming and say सर मुझे खून कम है मेरा, मुझे खून चढ़ा दीजिए. तो मैं बोला रुकी रुकी रुकी, मतलब खून कितना है, क्या वजह से कम हुआ है. खून खतरनाक चीज है, किसी का खून चढ़ाना. तो
mhm,
ये बहुत सोच विचार के बात करने वाला चीज है. So, so then, as doctors, we don't blindly listen to our patients who are
mhm,
come and made a request, or coming and demanding some procedure to be done on them, or simple चीज. कोई भी कोई भी व्यक्ति मेडिकल शॉप जाके ऐसे नहीं पूछ सकते कि मुझे थोड़ा कोडीन कॉफ सिरप दीजिए क्योंकि मुझे खांसी हो रहा है.
mhm,
कोडीन इज एन अब्यूज ड्रग, and we know that government has regulated the prescription and distribution of drugs like this. So nobody can come and demand things on others, especially invasive procedure, especially on doctors. So what we do is, we sit with the patient and go through the reports and help them understand whether blood transfusion is needed, जो ऑपरेशन जरूरत है या नहीं, और ऑपरेशन का रिस्क क्या है, ऑपरेशन में क्या होता है, क्या निकाला जाता है, क्या क्या चीजें गड़बड़ हो सकता है, क्या क्या फायदा आपको मिलेगा या फिर फायदा मिलेगा या नहीं, या दवाई के साथ इसका इलाज कर सकते हैं. सो वी गिव देम अ सेंस ऑफ रियलिटी व्हेन पेशेंट्स कम एंड डिमांड विथ यू समथिंग. वी टेल देम व्हाट एक्चुअली इज हैपनिंग हियर, जिसके वजह से आपको लग रहा है कि ये करने से आपको राहत मिलेगा. लेकिन सडनली दिस अबॉर्शन इशू हैज रिसन अप टू अ फैक्ट दैट नाउ देयर इज नो रियलिटी चेक, देयर इज नो सही या गलत. यहाँ यहाँ ये बात भी नहीं होता है कि यहाँ क्या होने वाला है. Without telling all of that, we are supposed to give blindly to us any lady who comes and demands of you abortion, or requests of you abortion, or considers abortion. What are we doctors supposed to do? I am going back to what I said early. We have a duty to protect life. We have a duty to do no harm. That is the first Hippocratic oath. पहला चीज ये है कि गलत नहीं करिए, जान को बचाइए. दैट इज आर, वो कसम करके ये काम पे गुजरे हम. और अभी बोल रहे हैं कि जो मर्जी है मरीज का वो करा दीजिए. Since when are we doctors starting to think like that? So forget the morality behind abortion or killing children or terminating pregnancy. I am even I am taking two steps back and asking, what are we doctors supposed to do with anyone who coming to us with a problem? We are going to frame the problem with a correct sense of reality and sense. वो है हमारा कर्तव्य, इसलिए हमने पढ़ा है. तो लोगों के जो मिसकंसेप्शंस है, लोगों को जो सोच विचार है अपने अपने शरीर के बारे में, अपने बीमारी के बारे में, उसके लिए. लेकिन लाइक फॉर एग्जांपल, विल नॉट प्रोलॉन्ग दिस आंसर, लास्ट एग्जांपल, लॉट ऑफ पेशेंट्स कम टू मी थिंकिंग they are unwell or they are having some disease. जैसे लोग आते हैं सिर दर्द के साथ, सोचते हैं कि ब्रेन ट्यूमर हो गया, या पेट दर्द के साथ, किसी को घर में कैंसर हुआ है तो सोचते हैं कि ये कैंसर का लक्षण है. तो मेरा क्या काम क्या है? आई हैव टू सिट एंड फिगर आउट बाय टेकिंग अ गुड हिस्ट्री. जैसे मरीज के साथ सवाल करते हैं, कब हुआ, कैसे हुआ, कब से है, क्या क्या परेशानियां हैं, एंड examine the person, touch and feel, and put my stethoscope and make them lie down and check their eyes and everything, and do full examination and do test जो साबित करने के लिए जो हमारे शक है, and then prove what the or prove or get evidence on what exactly is happening. और बहुत बहुत टाइम यही मेरा काम है कि लोगों को रीएश्योर करना कि कोई भी बीमारी नहीं है. My major chunk of my work is reassuring the patient that I don't think there is any serious illness. और ये बोलते वक्त मरीज को पसंद नहीं है. मरीज सोचते हैं कि ये डॉक्टर मुझे कुछ भी दवाई देने वाले जिससे मेरा पूरा तकलीफ ठीक हो. My responsibility many times is to tell them that you seem like a healthy person, but there's so much more going on in your life than what you think is happening, than what you think is a disease. So many people have a very difficult life circumstances, things which they are not able to cope, things which they are not able to share, and that is that is causing indigestion, or that is causing headache, or that is causing weakness or tiredness or feverishness and all of that, and they think that's a disease. So what I'm telling is, good healthcare is helping the patient see things from a right perspective, to understand what is really happening, to explain to them that this is what is happening in your body and this is what is causing the problem. So abortion is not healthcare. It is not health promoting nor caring for the mother or the baby in a true sense, because pregnancy is a natural phenomenon and women are designed physically with breast and uterus to nurture and carry their children and provide for them for 9 months, and the wiring is already there inside them. And it's a miracle that how a one-celled embryo or a blastocyst grows through various stages and grows as a full-blown human being with amazing potential. And the physiological process of pregnancy should not be tampered with by halting the by intervening and by actively killing them. And destroying humans is not why many of us doctors signed up for this sacred profession. and I have to tell my patients that जो आप करने वाले हैं या जो आप सोच रहे हैं, it has implications in it. And when you indulge in sex, which is a good thing, which is a desirable thing with your husband or with your partner, you're committing to something which has procreative potential. And जैसे सब काम के लिए कुछ फल मिलता है, every action has a fruit at the end of it. You can't run away from the responsibility when you indulge in something which has procreative potential. And
So
by
this is where the women take the choice, right?
yeah,
Women have the choice.
I mean, most of the pregnancies are out of choice and out of something you want to do. And just like when I become a doctor, when I get an when I get lot to see, बहुत सारे बूढ़े लोग आके मुझे सर बुलाते हैं, बहुत सारे मुझसे भी बड़े लोग आके मुझे बहुत रेस्पेक्ट देते हैं. And if I don't live up to that standard, मेरा मेरा प्रोफेशन का बदनामी भी है, और मैं आई एम बीइंग irresponsible of my status and my action. So when you indulge in when you do sex, or when you want to enjoy the privileges of enjoying the pleasures of intimacy,
Marriage.
my marriage and intimacy and sex, you are participating in something which is God has created for bringing more people into this world. And so you can't get involved in bringing children to this world and then claim your rights of not wanting children. Yeah, so I think that's a long answer, but I think
No, no,
I think
that's
the
fine.
issue is more than
Yeah.
not getting abortion. The issue is you are the way you approach children, the way you look at
Right.
sex, where you look at what is the potential of what you are engaging in has implications on how you
Right.
think about pregnancy.
Right. So there are lots of presuppositions and assumptions behind these surface level questions that we ask, right? Ethical questions that we ask. That's so true. Before moving ahead, as we are talking on this topic of abortion, just for the people who are watching, uh, if you can like define for us, like when we talk about abortion, very easily people get confused between abortion, miscarriage, and even therapeutic and non-therapeutic. Like just now you spoke about saving the life of a woman. Like I don't think this is a very like common, like it might be common, but compared to the all the pregnancies that as you said, it's not a normal thing, right? Pregnancy is a normal thing. So what's the difference between therapeutic, non-therapeutic, miscarriage, all these things, and which of these are evil, as we
Yeah,
can, right? If you
yeah.
can speak on
So
this.
one writer has said that whoever owns the dictionary owns the world. So मतलब जो भी अलग अलग चीजों का नाम रखते हैं, उनको पूरा दुनिया का शक्ति मिलता है. So we have to understand the various terminologies and clarify the meaning of various
Yes.
terminologies to really make judgments and sense of what we are dealing with. So, uh, let's call everything abortion. So, abortion is simply the termination of any pregnancy, any pregnancy which is conceived by a lady with a fetus inside, with a life inside, by any method uh, before the fetus can be born alive. Yeah. So before the fetus can survive independently outside of the womb. So that is what is abortion in simple terms. So spontaneous abortion, अपने से होने वाला abortion is actually miscarriage. So miscarriage can happen without anyone intervening, without getting any medical intervention done on them, or any medicines or treatment being done. So in simple terms, spontaneous abortion is miscarriage, and what we are talking about is actually an induced abortion, जिसके लिए डॉक्टर लोग या किसी या मरीज को अपने से कुछ करना पड़ता है उसको रोकने के लिए, जो प्रेगनेंसी शुरू हुआ है, जिसका जो जिंदगी शुरू हुआ है अंदर, जिसके साथ प्रेग्नेंट है उसको रोकने का प्रोसेस को इंड्यूस्ड अबॉर्शन बोलते हैं. So, like one way to compare this is cardiac arrest and heart attack. People call so जिसको भी जो भी व्यक्ति मरता है आखिरी में, everyone will have a cardiac arrest. Your heart has to finally stop, and your so the heart or the cardiac organ of your body has to stop. That is cardiac arrest. लेकिन heart attack is actually not all cardiac arrest are because of heart attack. Heart attack actually means MI, myocardial infarction, और दूसरे शब्दों में हार्ट में ब्लॉक होने की वजह से जो हार्ट रुकता है उसको हार्ट अटैक बोलते हैं. लेकिन बिना हार्ट अटैक के भी लोगों को कार्डियक अरेस्ट हो सकता है, जैसे सिवियर इन्फेक्शन की वजह से. सो देयर आर वेरियस वेज ऑफ डूइंग अबॉर्शंस. नॉट ऑल अबॉर्शंस आर induced. Women can get pregnant and can so कुछ लोगों को मालूम होता है कि हम मैं प्रेग्नेंट हुए हैं, और एंड व्हेन दे गो फॉर द अल्ट्रासाउंड दे वुड रियलाइज दैट देयर इज नो फीटल कार्डियक एक्टिविटी. बच्चा पेट में ही मर गया है बिना कोई तकलीफ के. दे मे नॉट हैव ब्लीडिंग और दे मे नॉट हैव abdomen pain. We call it missed abortion sometimes. Missed. So that is missed, and sometimes people can have bleeding. And when they go and do an ultrasound, the fetal cardiac activity, बच्चा अंदर में मरा नहीं होगा. So they might be, so that is called a threatened abortion. Bleeding, but the embryo or the fetus is still living. Sometimes ऐसे भी होता है कि ब्लीडिंग हो गया है, शुरू हो गया है और इतना ज्यादा हुआ है कि बच्चा अंदर में गुजर गया है. So bleeding with an open uterus and indicating that the process cannot be stopped. It is going to happen. Inevitable. We call it inevitable abortion. और sometimes they can be already बच्चा गुजर गया है, excessive bleeding हो गया, और incomplete abortion. That means जो भी प्रेग्नेंट हुए थे, जो भी फीटस था अंदर में, वो गुजर गया है, एंड fetus has almost come out, but some products of conception is still remaining inside. And they can be complete abortion where all the products of conception, जो भी fetus था अंदर में, जो भी embryo था, पूरा बाहर आ गया है. So these are the types of abortion. But what we are talking about is induced abortion, where the expulsion of the product of conception, which is the fetus, वो कोई तरीके के साथ, that is induced, and you are intentionally terminating the pregnancy through external intervention, either by medical means, दवाई लेने से, mifepristone और misoprostol, which are the two commonly used drugs, वो लेने के वजह से induced abortion हुआ है, या surgical means like manual vacuum aspiration या suction evacuation और ऐसे कुछ. And they can be therapeutic. Induced abortion, जो जानबूझ के हम abortion कराते हैं, that can be because of therapeutic reasons. So therapeutic and non-therapeutic are again legal terms. Therapeutic ऐसे term है जैसे continuation of pregnancy poses a risk to the mother's life or health. तो MTP एक्ट में ऐसे लिखा है कि जो माँ है उनके सेहत के लिए या उनके जान के लिए खतरा है, फिजिकल या मेंटल हेल्थ, एंड देन यू हैव टू थेराप्यूटिकली. तो डॉक्टर कैन गो हेड एंड डू अ थेराप्यूटिक अबॉर्शन. Those are the legally allowed indications for them. Or there are non-therapeutic reasons, like suddenly the government says that the population of the country is too much, you should limit the number of children, and somebody who is more than 2 times pregnant should not continue their pregnancy, जैसे चाइना में करते थे.
Right.
They had a one child policy during 1970s. During the emergency, there's a lot of sterilization drives where government was intentionally trying to sterilize women so that was a permanent contraceptive measure, but there was also a lot of push for limiting the family size to 2 children, and there was a lot of abortions happening at that time. So that is like a non-therapeutic way. And sometimes non-therapeutic can also mean social reasons, जैसे किसी को I mean, there be unmarried people who become pregnant and they don't want to continue pregnancy. So those are the non-therapeutic reasons.
Financial reasons की वजह से भी कई लोग करते हैं,
Yeah.
family pressure की वजह से. I think India में that's very common, right?
Yeah. So again, when MTP Act and when we talk about these things, no, so So we just talk about it like all that matters is what other people want to do with the pregnancy, including the lady who is pregnant.
Right.
She's not realizing that she's not a lady anymore. She's a mother. See, when we see when you for example when you go in metro, Desmond, you see बहुत सारे फौजी लोग वहां बैठे हैं आपके जहाँ जहाँ बैठने जा रहे हैं बहुत सारे सोल्जर्स बैठे हैं अपने यूनिफॉर्म में आप क्या करेंगे you salute at them or you say thank you for your service or something or you see some uh, or, or you see some one of your old teachers you are meeting after many years. What will you tell? Sir, thank you. आपने जो सिखाया उस टाइम में तो बहुत शरारत करता था लेकिन आपने मुझे अच्छी तरह सिखाया. Thank you for your service or thank you for teaching me. We respect them. There was a time where women who became mothers were looked up as lionesses, and they were given a lot of nobility and a lot of respect. And people who took challenges to bring up children to this world, who take care of their families, who sacrifice their bodies and their lives for their families. क्या हो गया है हमारे दुनिया को, क्या हो गया है हम लोगों को? See that we stop looking at motherhood as a great thing. You know, more actually the industry, the greeting card industry for Mother's Day makes 10 times more profit than Father's Day or Valentine's Day. You know that? That's crazy. Why? Because all of us value our mothers, and all of us have a we have all of us have a navel, or all of us have a belly button, which proves to us that our mothers decided to keep us as children and took the trouble of carrying us for 9 months. It's not a khel ka baat, okay? I have been pregnant with my wife for 2 times, and I don't have. When every time I had to fight with, every time I fight with her, I just had to look at all the scars she may has suffered for our children, and there is if they have at least a tiny bit of humanity left in me, I had to thank her for all the joy she gives to me through the children and the sacrifices she made. So, what I'm trying to tell is we have forgotten the value of motherhood, and we have just eliminated the beauty and the sacrifices which our mothers have made for us. And we live in a self-centered world. So there's a funny thing which I did in preparation for this interview. I just put in my chat board, chat GPT, I put give me some alternate terms for medical termination of pregnancy, which actually realistically tells the real meaning of the term. Okay? So I'll read out to you
Please,
the
please, please.
answers.
Yeah.
Which, so ChatGPT is not Christian or religious or anything. So what it tells is first thing is so they said that they put creatively framed and directly put terms. Okay, for medical termination of pregnancy. First thing is unborn child execution. Unborn child execution highlights the deliberate act of ending a life, framing it as an unjust act against a defenseless human. Second one, preborn life destruction emphasizes the living nature of the child before birth and the destructive outcome of the procedure. Third thing, intentional fetal homicide. दिल्ली में तो आप दिल्ली में रहते हैं. Lot of homicide people are always caught. When do we call people homicide? When they use force or violence to kill somebody else.
Right.
Is not allowed other than for other than for self protection or anything. And this legal sounding term imply that the act which is undertaken with the name of termination of pregnancy and abortion is akin to killing a person, and that it focuses on the intent and the victim's humanity. I can go on. Killing of the unseen innocent, abortion of a living soul, preborn person eradication, destruction of an image bearer, whatever. So we should stop using terms which soften the procedure's reality. I was telling you before, doctors are here to give sense to patients. We work with their bodies. We work with the physiology. We can't work against physiology. हमारा काम है जो पैथोलॉजी है, जो फिजियोलॉजी को बिगाड़ रहा है उसको सही करके फिजियोलॉजी करना. I tell my patients when they are diagnosed with any disease कि मेरा आज से आपके साथ काम ये होगा कि आपको नॉर्मल जिंदगी जीने के लिए तैयार करना. मैं नहीं चाहता हूं कि आपको मेरे कब्जे में रख के मरीज बना के रख के मैं आपसे पैसा बनाते रहे और आप मेरे अंडर में मेरे मरीज बन के रहे. आज से आपका बीमारी का सिरदर्द मुझ पे है और या मेरे पर है. मैं वो टेंशन आपसे उठा रहा हूँ और आपका काम है नॉर्मल जिंदगी घर में जाके जीना या जो भी आपकी जिम्मेदारियां हैं जो भी आपको आपको करना है पापा बन के मम्मी बन के बेटा बन के दामाद बन के बहू बन के करते रहिए और गोली लेते रहिए और नॉर्मल जिंदगी जिए. And I don't try to label them as a disease patient or a diagnosed or a patient with a diagnosis. I am telling them that बीमारियां तकलीफें दुख कष्ट जिंदगी का भाग है. It's part and parcel of living. Sometimes I tell some of the patients who are very surprised that they have a disease. I said, welcome to real life. जिसमें बीमारियां तकलीफें होता है. सो एंड देन आई टेल देम तो क्या है हम हार नहीं मानने वाले हैं. ये जो बीमारी आपके सर पे चढ़ के आपको दिक्कत दे रहे हैं उसको पैर के नीचे लाएंगे और नॉर्मल जिंदगी जीने के लिए आपको पर्याप्त करने का काम है मेरा आज से. So I focus on health and well-being. And obviously they have a disease. I'm not going to underplay the disease. लेकिन करने का ये बोलने का इरादा ये है कि they can live free, independent life as human beings with the disease than a diseased person living in the world. So whatever the disease is, they can live with the disease when they realize that this is part of life. So to a pregnant lady who has come to me pregnant, what am I going to tell them? You are a lady. Ladies become pregnant. Women carry children. In fact, the wiring is towards every month you have bleeding as period or as menstruation because you didn't get pregnant. The uterus is one organ of the body which has only one purpose to carry children, to lodge fetuses. वो अच्छा घर है परमेश्वर बनाया हुआ बच्चों के लिए. That is the intrinsic biological function. Now we can play around with our anatomy and our physiology. And I have to warn them truly, scientifically, sensibly, that it all comes with a cost. I will be an insincere, untruthful doctor if I don't tell them the truth of what they are planning to do if they are terminating the pregnancy or killing the child or aborting the fetus. I have to tell them the physiological effect that has on your hormone cycle. I have to tell them the changes your uterus will suffer if a natural process is stopped. I have to tell them the truth. If I don't tell them, and I just simply listen or simply obey the government for whatever the rule is or whatever the law is, I am not being truthful to them. I'm not being truthful to myself. And I don't want to live a lie. And I don't want my patients to live a lie and then find out that I have covered up something or not revealed to them जो सच्चाई था जो करने वाले जो होने वाला है. Would you like to, will you forgive a doctor who made a diagnosis on your mother or your father for a disease, लेकिन फिर मालूम कैंसर था अलग कोई हॉस्पिटल में या we will not forgive, isn't it? We get angry. That means उनको काम करना नहीं आता है वो डॉक्टर को या वो गलत काम किया या वो जानबूझ के अपने नाम को बचाने के लिए काम किया. We are in a sacred profession and we are not, so if safety was our intention, सरकार को सब चीजों में विश्वास करके या जो भी चीजें लोग चाहते वो करने के लिए हम ये काम के लिए शुरुआत किए थे तो then this is a wrong profession. We are in a human being helping human being profession, and helping really comes with lot of truth telling and exposing the false understandings and misconceptions. And so whenever I have done, whenever real doctors have told women what they are carrying, when they are given a glimpse of life within them when they are pregnant, they choose life. मैंने सुना कि एक ऑर्गेनाइजेशन है यूएस में, वो क्या करते कि वो और कुछ नहीं करते, सिर्फ अल्ट्रासाउंड मशीन खरीद के
Mhm.
देते हैं डॉक्टर्स के लिए। जहां भी
Mhm.
जो भी डॉक्टर के पास अल्ट्रासाउंड मशीन नहीं है, और डॉक्टर्स को बोलते हैं कि आप सिर्फ प्रेग्नेंट लोगों को अल्ट्रासाउंड करके उनको बच्चे को दिखाइए, फिर उनको जो
Mhm.
करना है करने दीजिए।
Mhm.
So that initiative has shown the truth to the lady who is carrying a baby, and that has revolutionized the way they make decisions. So what we
Right.
want in our society is truth,
Mhm.
nothing but the truth, and
Right.
only the truth, and then allow people to make decisions, and
Make
they will, and
decisions.
whatever it is the decision, they will live with the decision which they're making on truth.
Mhm. Mhm. Great,
Sorry, I think
great,
I
sir.
spoke a lot.
No, 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 please don't don't apologize after every answer. No, but I want to come back to this before moving ahead because this is my genuine question. Yeah, I mean, I don't think it's malice, but if you spoke about kinds of abortion, you said there is spontaneous abortion, which is basically miscarriage or other terms that you use. Then there was non-therapeutic
So
abortion.
spontaneous and induced. इंड्यूस
Right,
मतलब आप कर रहे हैं अबॉर्शन,
right.
स्पॉन्टेनियस मतलब
हो गया.
अपने से होने वाला, या।
Right, right.
So
It's
10, so
sad, but
10 to 20% all pregnancies end up in abortions. 10 to, तो 100 लोग प्रेग्नेंट होते तो 10 लोगों को अबॉर्शन होने का रिस्क है अपने से।
miscarriage basically, right?
क्या मिसकैरेज, या सो या।
Okay. So my question is, as you spoke about induced abortion, therapeutic induced abortion, basically. Uh, I know government says that any physical or mental harm, but I'm sure even as a Christian and someone who has this moral ethics, uh, there might be some cases where this kind of abortion is morally and ethically okay. Like maybe when the mother's life is in danger, because even as we speak about this 1971 act, before this MTP Act came, there was already an act before that, right? 1860 or 1870 something, which said that when the life of the woman, life of the mother is in danger, in those cases, abortions are allowed. I mean, I
या
might be wrong here, but do you think that that makes sense? I mean,
So there are situations obviously where
mhm,
a lady is already unwell.
mhm,
वो फिजिकली हेल्थी नहीं है
mhm,
ऑलरेडी अपने से ही,
mhm,
और अभी जब
mhm,
प्रेग्नेंट हो गए हैं तो जो तकलीफ ऑलरेडी था वो, प्रेगनेंसी इज a stressful situation, though it's a
mhm,
physiological process.
mhm,
Pregnancy, childbirth put lot of stress on your body systems,
mhm,
and there are a lot of changes which happen in your body. Your blood volume increases,
mhm,
there is increased requirement of nutrition, all of that.
mhm,
So and there is stress on your heart, there's stress on your kidneys, things like that. So
mhm,
so for example, and there are also situations when the lady might apparently seem to be healthy, and when they become pregnant a new problem is found later on, that now that there's an extra stress on your body, something which was unmasked, something which was masked, become unmasked. Say, for example, your heart might be functioning just about okay and you are surviving without much problem, or you are not caring about some symptoms, and when you become pregnant, there is a heart problem which has been found, or some valve problem which has become worsened because of the pregnancy. So there are situations where pregnancy, getting pregnant, becoming pregnant, and carrying on with pregnancy can be problematic for a woman's health,
mhm.
uh, uh, and can also put them in danger. And
Right.
but first of all, these first of all we should know that these situations are very rare, extremely rare, and
Mhm,
the medical science has developed now that there's a lot of solutions which can offer even in such situations. uh,
mhm,
but obvious but still there are situations when delivery can put a lot of stress on the mother,
mhm,
and continuing taking pregnancy from 9 months can worsen the underlying situation or can even cause danger to their life. But let me just step back and think about this situation. When we are talking about saving the mother of, I mean, saving the life of this mother whose life is in danger because of pregnancy,
Mhm.
what are we
Mhm.
trying to protect this person from? Are we going to protect this person from some germ or some microorganism or some virus or some bacteria or something which is really harming her, invading her, attacking her? What are we talking about here which is causing the danger? We should focus on the fact that we need to answer the question, what is inside her? What is the
Mhm.
pregnancy? What is this
Mhm.
unborn uh, person first? And if the
Mhm.
unborn are not human beings, then
Mhm.
we should do everything possible to save the human being involved. Do
Right.
whatever you want, have an
Right.
abortion for that reason or any reason. But if the unborn are human
Mhm.
beings, then we have to ask the
Right.
question, what do we do if there are two human beings in danger and
Exactly.
one may be
Yep.
threatening the life of the other? So, for
Mhm.
example, if there are two drowning people,
Mhm.
one is panicking and about to kill the other, you might be able to save one person as a lifeguard. If you're a lifeguard,
Mhm.
you're trying to save one person, but you wouldn't push
Mhm.
one of these people under the water and purposely
Mhm.
and try to use them as a flotation device to save the other person. Na?
Right. Right.
हम
Right.
मैक्सिमम कोशिश करेंगे
दोनों
दोनों
बचाने की.
लोगों को बचाने के लिए, लेकिन
Right.
ऐसे पॉसिबिलिटी नहीं है तो एक जन को एटलीस्ट बचाएंगे, लेकिन दूसरे जन को हत्या करके एक जन को नहीं बचाएंगे ना.
Right. Right.
Huh?
Right.
You can, if you can only save one of the two people in distress, you cannot
Mhm.
directly kill one person in order to save the life of another person. If two people are seeking
Right.
a lifeboat, one cannot
Mhm.
kill the other just to keep the boat from not sinking. हाँ,
Right.
so वो हमें याद रखना है. So for
Mhm.
early in pregnancy, लाइक सोच लीजिए कि मम्मी को यूट्राइन कैंसर डायग्नोस हो गया, तो हम कैंसर का इलाज
Mhm.
करना जरूरत है यहाँ दोनों के
Mhm.
लिए. कैंसर बढ़ के बच्चे
Mhm.
को भी तकलीफ दे सकता है, मम्मी कैंसर फाइल के मम्मी का भी जान को खतरा हो सकता है. हम uterine
Mhm.
cancer, we have to give chemotherapy, and when we give
Mhm.
chemotherapy to the mother to save the, I
Mhm.
mean, save the mother and the host of the baby, sometimes the baby can die because of the treatment. लेकिन वहां हम जानबूझ
Mhm.
के बेबी का हत्या नहीं कर रहे हैं. But there
Right.
are situations where the mother's life in danger and a faster and a safer emergency cesarean section can
Mhm.
help save the baby or at least give
Mhm.
a chance of survival for the baby in a good neonatal center where
Mhm.
we are. What we are trying to say is what we are trying to say is we have to do everything possible to
Mhm.
save the life of everyone involved in a difficult situation.
Right.
We should
Right.
try to do everything. That doesn't mean that we might end up doing end up saving the
Mhm.
world, end up saving everyone. But
Mhm.
doctors are pledged not to intentionally or directly kill any human being, and we
Right.
consider the unborn um, baby inside
Mhm.
who is still living as a human being.
Mhm.
We have to do
Mhm.
everything possible,
Right.
and the mother should also be taking part in the decision making process.
Right.
She should not later on feel that I sacrificed the baby for saving myself. Tell me
Right.
which mother doesn't feel pride in the fact that she brought a baby to the world,
Mhm.
and a women are wired for such kind of caring
Mhm.
nurturing. That is why the best
Mhm.
nurses are always women. That is why the best people who care for others are always women.
Right.
And you don't have to artificially cover up these things from a lady who is
Mhm.
going through a life threatening situation where she should
Mhm.
feel guilty later on that अपने जान के
Mhm.
लिए दूसरों का जान का दे दिया. In fact, we
Right.
see, if there is a situation where you are inside a room locked up by some kidnapper and you have a child with you and there is
Mhm.
little water, you will try to drink as much water and trying to not protect the baby. You are
Right.
in a situation where you have to help that baby. You are morally
Mhm.
responsible for that baby or a
Right.
child, and you always try. We have movies no like that जहाँ लोग बच्चों के साथ
Mhm. Right.
मतलब घूमते रहते हैं या मतलब जंगल में यहाँ कहाँ बच्चों को भी साथ में लेने के लिए और साथ में बचाने के लिए. So
Mm.
this sacrifice is always looked up with nobility, and we
Yeah.
always uphold people who
Mhm.
sacrifice for others. So the mother should be allowed to know the truth and uphold the sanctity of life in all
Mhm.
circumstances. And
Yeah.
yeah, and so then so many times when MTP says if the pregnancy is threatening the mental health of the mother, you can
Yeah.
give you can offer abortion. There
Mhm.
not we are not talking about terminating the pregnancy for protecting the life of the mother. We are telling
Right.
we are doing the abortion to protect your lifestyle. जो
Mhm.
तरीका आप रहना चाहते हैं
Right.
उसके लिए कोई
Convenience.
तकलीफ ये प्रेगनेंसी से नहीं होने के लिए हम आपको अबॉर्शन करा रहे हैं. I
Right.
don't understand what is happening to our world. Since when did we start prioritizing our comfort at the expense of others? So I just
Mhm.
children for sleep and fed them and switch on the fan and the mosquito coil and all of that and come and talking to you. uh,
Mhm.
and and I hope you respect me for that. And if you come to know that I have just locked them up with a plaster on their mouth, not to make sound when I'm doing this interview, or kind of killed one person because he's troubling me a lot for the whole day when I was supposed to rest, what will you think? Whom you're interviewing? This nasty, horrible human being.
Mhm.
एंड अभी हम बोल रहे हैं जो घर में बच्चों को रखना है, उस घर में आपको बच्चे आने से दिक्कत है तो आप अभी आप निकाल दीजिए और उसको उसको छुड़ा दीजिए एंड देन आप
Mhm.
शांति से रहिए.
Mhm. Right. Right. I
Have gone.
think.
Our
Yeah.
our morality is just
Say clown world, as Pastor Doug says, right? Yeah. Yeah. As you said, I think it all boils down to this one fact that the fetus, the embryo, whatever you want to call it, it's a living human being, right? And if it's a living human being, then it has living rights of a living human being, rights of every other human being that there is, right? So I think when we talk about the arguments that are made against this, often this idea of viability comes in, right? And that's where MTP also stands, right?
yes,
Earlier 1971 it came in place because they said that viability is up to 20 weeks. After 20 weeks, the baby can survive or whatever. It came up to 22 weeks now, if I'm not wrong,
yes.
right? So for some reason viability has become the marker of this human rights now, right?
So
A human
viability,
get
yeah,
yeah.
yeah. So viability is defined as the chance for survival of a fetus outside the
Mhm.
womb.
Yeah.
सो 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 हम जानते हैं कि 9 महीना मतलब 40 हफ्ता बच्चे को पेट में रहना है बाहर नॉर्मली पैदा होने के लिए. So
Mhm.
at least 32 to 34 weeks are needed for the lungs to develop to be born without any problem in breathing. ओके, तो प्री टर्म डिलीवरी जब हम करते हैं टाइम के पहले 40 हफ्ते के पहले 9 महीना का पहले एटलीस्ट 8 महीना चाहिए 32 to
Mhm.
34 weeks for a normal human being to survive outside. But
Mhm.
thank God our science and technology are so evolved or so well developed now, thanks to the hard work of lot of neonatologists and pediatricians and scientists, that we are able to save 24 weeks, 28 weeks, even in some Scandinavian countries, 18 to 20 weeks of pregnant, I mean, 18 to 20
Mhm.
weeks old, the fetus also are surviving. So
Mhm.
the definition of viability will differ from country to country based on how much of neonatal care, yeah, how much of good facilities you can give for the baby which is born at a premature age. And like I told, fetuses as young as 20 weeks have survived. And
Mhm.
so historically in India, the viability was at 28 weeks, then came to 24 weeks, और अभी 20
Mhm.
to 24 weeks भी बोलते हैं. So
Okay.
advancement neonatal care has pushed this threshold earlier, and in high resource settings in a city, 24 weeks is with good neonatal support in an ICU can survive. And according to MTP, the 2021 amendment, it says that MTP Act has extended the gestation limit for abortion to 24 weeks in specific cases. Like if the lady is pregnant after a rape, or the baby has fetal abnormalities, or there is some grave injury to the mother's health, ये तीन सिचुएशन में एमटीपी एक्ट बोलता है कि 24 वीक्स के पहले आप अबॉर्ट कर सकते हैं. But like I already said, from a perspective of knowing that this is not just an abortion or not just termination of pregnancy, यहाँ किसी का जान लेने का काम करने जा रहे हैं. A doctor obstetrician is going to actively do an intervention, whether by tablets or medicines or operation, to actively end the life of a human being with a beating heart, with a small hands, small feet, small naak, small kan, small chehra. When we realize that the concept of viability is a problematic benchmark, because it implies that the moral value of the child or the worth of the child depends on his or her ability to survive outside the womb. आपको मैं हॉस्पिटल में डाल लूंगा, सोच लीजिए, मेरे साथ काम करने के लिए, मेरे जूनियर डॉक्टर बन के, तो डेसमंड आप एक दिन भी नहीं सर्वाइव कर पाएंगे. इतने सारे तकलीफ आप देखेंगे मरीजों के साथ कि आप सोचें कि मैं बाप रे ये क्या जिंदगी है. So if I put people in when we put people in difficult circumstances which they are not trained or ready to survive, no, some people commit suicide when they go and work in very difficult situations.
Yeah. Yeah.
A new graduate goes to a very busy MNC, multinational company, where the stress is too much, can't handle. They can commit suicide, or others can kill you if you are so bad for others. So a person's value doesn't come from their performance or their ability to survive or their maturity. And what really gives the value to a person is what is their ontological status, what is their intrinsic worth, what is their relationship with the rest of the species. So if we believe that the um, first cell which is formed after fertilization and then later on gets conceived by implantation, when conceived and grows as an embryo, has all the potential to become a full-fledged human being, has all the genetic material, the DNA, which is separate from the parents, and has can become a president of India, can become a doctor, can become an engineer, can become A.R. Rahman with composing beautiful music, can become Sachin Tendulkar or Virat Kohli. If we say that person has all that potential, and if you are allowed to continue the natural process, this person will survive, then what right are we going to tell them that I don't think you can survive based on how you look now or how you're performing now? We pick up friends after long-term relationships, isn't it, with people? We test their value, how they are going to perform, how they behave, and we're going to call a 2 week, or we're going to call a 10 week, 12 week, 20 week person that just because you're small, just because you don't look like me, just because you look little bit different, you're not fit, then we are going to tell all the disabled people the same message. We can't change the message, we have to be consistent.
Right.
क्योंकि आपके चेहरे में बड़ा सा दाग है, या आपका पैर एक काम नहीं करता है मेरे जैसे, या आपका बाल अलग दिखता है, या आ, आपके पेट में ये जो चीज़ है जो मुझे नहीं है, आपको कोई कमी है, या आप मेरे जैसे अच्छा नहीं है. That sends a message. Yeah.
Right.
So survive, our worth doesn't depend on our stage or the timing of our life.
Right. Yeah, I think there's a lot to talk on.
Yeah.
We've already covered a lot of things. Kafi late ho gaya. I don't want to keep you any longer. I think we'll meet again. We'll
Yeah.
meet again. There's a lot to talk on MTP Act, like लॉ के साइड से एंड हाउ इट इफेक्ट्स द मेडिकल इंडस्ट्री एंड ओवरऑल काफ़ी चीज़ों पे बात करनी है सर। थैंक यू आपने इतना टाइम दिया। आई वोंट एंड इट लाइक दिस। कुछ अगर आपको लास्ट कमेंट या लास्ट कुछ ऐड करना है जस्ट टू कंक्लूड दिस फर्स्ट episode or meeting, what do you want to call? So I just want to give you.
I, I'll just I'll just end with a personal note.
Mhm,
I might break down if I say this story, but bear with me. I hope I will not. When Daisy and I got married in 2017, and I, I just got into my PG, and she decided to not join PG immediately because she wanted to make a decision about which PG to take, which stream of medicine to take. And she was at home. She just took a break, and that was good for our marriage because I was very busy and I could come back to a home with a
mhm,
lady managing the home and giving me food and giving me support and love and care. So that time was good for our marriage. I was extremely busy, and then when Daisy was ready for choosing which stream of PG to take and join form and gave application form and was everything was ready for her to join PG 1 year after we got married. We came to know that she was pregnant,
mhm,
and that was really a sort of like a unplanned pregnancy because you don't take on a big responsibility of a baby when you are joining PG, which is very hectic time.
mhm,
Then we thought, what is happening? We were not really planning, but when in fact no pregnancy is unplanned, isn't it? You are doing something towards that, and when that happens, it should not surprise you in a way because, like I was earlier telling you, you live in the aftermath of the choices you make. So then we were just getting used to the fact that that Daisy has become pregnant, and we had to go about it, and we're very anxious also, and all of that. And a week later, she had bleeding, and we thought we lost our child. So we were just getting to used to the fact, and suddenly she bled. When we went for an ultrasound, and then we found out that it's only a threatened abortion. That means the fetal activity is still there. There's bleeding,
mhm,
but the life is still alive. Is fetus is still alive and viable. So she just had to take rest, and if there's no further bleeding, the pregnancy might survive. So she took all the precaution, took rest, took the medicines which required to support the pregnancy. And
mhm,
I remember one day, then pregnancy got sorted out. She joined PG, and it was very difficult. And when we met one of my professors, and I told her that this baby was not really planned, and she told me something that, Don, there's never a perfect time to plan a baby. Children come when they are supposed to come, and you don't measure God's blessings, you receive it with both hands. Looking back, I would not have survived a difficult PG in my college, and Daisy would not have survived her PG, and maybe we would not have survived a difficult period of our marriage if Ashay hadn't come at that time. And by the time Daisy was finishing PG, there was COVID, and because we had Ashay by then, we were parents, and we were more mature to face a very difficult season, a very suffering season in this world, and this 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 life of ours. So all I'm trying to say is, bringing a child to this world was not planned by us, but God given to our when God blessed us with a child. And we are some of my batchmates are still getting married now, actually. And
mhm,
God has blessed us with two children. Not to say anything boastful or anything, just that things have happened, and our lives are more than the choices we make. Our lives are not under the masterful decisions which we make and the perfect choices we make. I am not the captain of my ship, or the person in charge of my destiny. I have bet my life on the fact that God is in charge of my life, and Jesus is sovereignly controlling everything in my life. And when I see my life from that perspective, children have blessed me, and I can come back from work to a house which is chaotic and noisy and full of fun and problems to solve and toys to put back, and I sometimes look at Daisy and tell, how else would you have lived your life as a young person other than being spent and tired at the end of the day for your children? That's a good life, guys. That is a blessed life, and it's better than we traveling the world or lying down in a beach holding hands. It's okay to be spent and tired at the end of the day with with the responsibility of nurturing children and seeing your image growing in them, they becoming better than you, and blessing your life and this world and our extended family. So all this to say, my life has been blessed by the children which God gave and the pregnancies we went through together. And Daisy even had diabetes in the second pregnancy, and she had to take insulin from the second month till ninth month for treatment for the pregnancy related diabetes. So all of this has made us stronger, made us mature for helping our patients who come with to us with various problems, and we know what it is to suffer. We know what it is to, I mean, our sufferings have been much less compared to other people, but we know what it is to go through things which we didn't want to happen if it was left to ourselves. So we are better for it. And when I speak about abortion and when I speak about saving the life of children, I'm not talking from a hollow head. I talk from experience, and we have been blessed to see people who take care of children well and who value children. And like I said, I have been surrounded by lionesses. My mother, my mother-in-law, my the people who have mentored me, the woman Ida Scudder, and all the women in the Bible who demonstrate to us the nobility of being a mother. And so this issue is a thing which is very close to my heart, and so yeah, I want to close with that, saying that our lives are more than what we can determine, and children are a blessing, and you can never live a life which is better than God's plan for your life, and your life will flourish when you follow God's design for your life. Everything else is a house built on sand. When you build on the rock of the truths which Christ tells you to do, when you obey Him, you can stand the storms and pandemics of this world. Long answer again. Sorry.
Please don't say sorry. Sir, it's your experience, your knowledge. So it's truly a privilege, just sitting here listening to you. Truly, truly. I mean, I cannot express in words. And,
Thanks
and
for the
I'm
opportunity to kind of articulate these things which have been running in my mind. Yeah.
it's my privilege. It's my and even the fact that we'll be doing it again, more episodes to come.
Okay.
I'm really excited. I'm really excited. I'm going to trouble you a lot now. So thank you so much, sir, for this. And I hope whoever is watching this, जो भी इसको देख रहे हैं इस conversation से वो आशीषित हो. और please, अगर ये conversation, I know काफी लंबी है, maybe we can cut it down to shorter pieces. But if this blessed you, please इसको आगे share कीजिएगा. And ज़्यादा से ज़्यादा लोगों तक ये मैसेज ये थॉट्स पहुंचाइए, राइट, जो which we need to talk about, right? As a church, as Christians, as people of Christ, we need to talk about these issues, right? और ज़्यादा time नहीं लूँगा. We'll end this. Thank you, sir. Thank you for and everyone who's watching. Thank you for watching. And yeah, praise God. Thank you.
Thank you.